Atrial fibrillation. Atrial fibrillation is a rare and often rapid heart rate that can increase the risk of stroke, heart failure and other heart-related problems. During atrial fibrillation, the two upper chambers of the heart, atria, beat violently and abnormally, without interaction with the two lower chambers, ventricles, of the heart. Atrial fibrillation symptoms usually include palpitations, shortness of breath and weakness. Pieces of atrial fibrillation may come and go, or you may develop chronic atrial fibrillation and may need treatment. Although atrial fibrillation itself is not life-threatening, it is a serious health condition that sometimes requires urgent treatment. Of particular concern is atrial fibrillation, the ability to develop blood clots within the upper chambers of the heart. These blood-forming blood clots can circulate to other organs and lead to ischemia. Treatment of atrial fibrillation may include medications and other interventions to try to change the cardiovascular system. Symptoms: some people with atrial fibrillation have no symptoms and do not know their condition until it is diagnosed during a physical examination. Those with symptoms of atrial fibrillation may experience symptoms and signs such as beating, which is a feeling of racing, discomfort, unusual heartbeat or a beating on your chest, weaknesses reducing the ability to exercise, fatigue, white dizziness, shortness of breath, chest pain. Atrial fibrillation can be from time to time. In this case it is called paroxysmal atrial fibrillation. You may have symptoms coming and going, usually lasting a few minutes to hours. Sometimes symptoms occur for about a week and episodes may be repeated. Your symptoms may go away on their own or you may need treatment. Persistence. With this type of atrial fibrillation, your heart rate does not return to normal on its own. If you have persistent atrial fibrillation, you will need treatment such as electrical shock or medication to restore your heartbeat. Persistence that lasts a long time. This type of atrial fibrillation persists and lasts longer than 12 months. Forever. In this type of atrial fibrillation, abnormal heartbeat cannot be restored. You will have atrial fibrillation permanently, and you often need medication to control your heart rate and protect blood clots. When to see a doctor: if you have symptoms of atrial fibrillation, make an appointment with your doctor. Your doctor may order an electrocardiogram to determine if your symptoms are related to atrial fibrillation or other heart disease, arrhythmia. If you have chest pain, seek emergency medical help immediately. Chest pain may indicate a heart attack. Causes: atrial fibrillation is an abnormal and frequent heart rate that occurs when the upper two chambers of your heart sense electrical signals. The result is a rapid and abnormal heart rhythm. The heart rate in atrial fibrillation may range from 100 beats to 175 beats per minute. The average heart rate is 60 to 100 beats per minute. Your heart is made up of 4 chambers, 2 upper chambers, atria, and 2 lower chambers, ventricles. Inside the upper right chamber of your heart, right atrium, there is a group of cells called the sinus node. This is your heart that builds a natural pacemaker. The sinus node produces a signal that normally triggers the beating of each heart. Typically, the signal travels through the 2 upper chambers of the heart, and then travels through a connection between the upper and lower chambers called the atrioventricular AV node. The movement of the signal causes your heart to squeeze, contract, sending blood to your heart and body. In atrial fibrillation, the symptoms in the upper extremities of your heart are strange. As a result, they tremble. The AV node, the electrical connection between the atria and the ventricles, is attacked by nerves trying to penetrate the ventricles. The ventricles also beat faster, but not as fast as the atria, as not all sensations pass. Possible causes of atrial fibrillation: abnormalities or damage to the heart structure are the most common causes of atrial fibrillation. Possible causes of atrial fibrillation include high blood pressure, heart disease, vascular disease, unusual heartbeat, congenital heart disease, uterus, excessive thyroid gland or other body imbalances, stimulation of exposure, such as drugs, caffeine, tobacco or alcohol, sinus syndrome, improper functioning of the natural pacemaker of the heart, lung diseases, previous heart surgery, infection with the virus, depression due to surgery, pneumonia or other illnesses, sleep apnea. However, some people with atrial fibrillation do not have heart disease or injury, a condition called fibrillation alone. In atrial fibrillation alone, the cause is often unclear, and serious complications are rare. Atrial flutter is similar to atrial fibrillation, but the rhythm in your atria is much more orderly and less chaotic than the unusual patterns common with atrial fibrillation. Sometimes you may have atrial flutter which develops into atrial fibrillation and vice versa. The risk factors and symptoms and causes of atrial flutter are similar to those of atrial fibrillation. For example, lashes irritate a person with atrial flutter. As with atrial fibrillation, atrial flutter is usually not life-threatening if properly treated. Risk factors: certain factors may increase the risk of atrial fibrillation. These include age. The older you get, the greater the risk of having atrial fibrillation. Heart disease. Anyone with heart disease, such as heart valve problems, congenital heart disease, heart failure, cardiovascular disease, or a history of heart attack or heart surgery, has an increased risk of atrial fibrillation. High blood pressure. High blood pressure, especially if not properly controlled by lifestyle changes or medication, can increase the risk of atrial fibrillation. Some incurable conditions. People with certain chronic conditions such as thyroid problems, sleep apnea, metabolic syndrome, diabetes, chronic kidney disease or lung disease are at greater risk of developing atrial fibrillation. Drinking alcohol. For some people, drinking alcohol can cause an episode of atrial fibrillation. Excessive drinking can put you at greater risk. Obesity. Obese people are at greater risk of developing atrial fibrillation. Family history. An increased risk of atrial fibrillation exists in some families. Problems. Sometimes atrial fibrillation can lead to the following problems. Stroke. In atrial fibrillation, the pulse can cause blood to enter the upper chambers of your heart, atria, and form clots. In the event of a blood clot, it can travel from your heart to your brain. When it can block blood flow, it causes a stroke. The risk of stroke in atrial fibrillation depends on your age, high risk as you grow older, and whether you have high blood pressure, diabetes, history of heart failure or previous stroke, and other factors. Certain medications, such as anemia, can significantly reduce the risk of stroke or other physical injuries caused by blood clots. Heart failure. Atrial fibrillation, especially if uncontrolled, can weaken the heart and lead to heart failure, a condition in which your heart is unable to circulate enough blood to meet your body's needs. Prevention. To prevent atrial fibrillation, it is important that you live a healthy heart rate to reduce the risk of heart disease. A healthy lifestyle can include eating a healthy heart diet, increase your physical activity, avoid smoking, maintaining a healthy weight, reduce or avoid caffeine and alcohol, reducing stress, as excessive stress and anger can cause heart rhythm problems. You take precautions, as some cold and cough medicines contain stimulants that can cause rapid heartbeat. Atrial fibrillation diagnosis. To detect atrial fibrillation, your doctor may review your signs and symptoms, review your medical history, and have a physical examination. Your doctor may prescribe several tests to determine your condition, including electrocardiogram, ECG. An ECG uses tiny sensors, electrodes, attached to your chest and arms to sense and record electrical signals as they travel through your heart. This test is a key tool in diagnosing atrial fibrillation. Halter monitoring. This portable ECG device is taken from your pocket or worn with a belt or shoulder strap. It records your heart activity for 24 hours or more, giving your doctor a longer look at your heart rate. Event recorder. This portable ECG device is designed to monitor your heart activity for a few weeks to a few months. When you experience symptoms of rapid heartbeat, you press a button, and the ECG line for the past few minutes and the next few minutes is recorded. This allows your doctor to determine your heart rate during your symptoms. Echocardiogram. This test uses sound waves to create moving images of your heart. Usually, a transducer is held in your chest. Sometimes, a flexible tube with a switch is directed down your throat to your chest. Your doctor may use an echocardiogram to diagnose heart disease or blood clots in the heart. Blood test. This helps your doctor eliminate thyroid problems or other substances in your blood that could lead to atrial fibrillation. Pressure test. Also called an exercise test, A stress test involves using exercises in your heart while exercising. Chest X-ray. X-rays help your doctor determine the condition of your lungs and heart. Your doctor may also use X-ray to diagnose conditions other than atrial fibrillation that may explain your symptoms and signs. Treatment. The treatment for atrial fibrillation that best suits you will depend on how long you have had atrial fibrillation, how much your symptoms are bothering you, and the underlying cause of your atrial fibrillation. Generally, the goals of atrial fibrillation treatment are: reset rhythm or control rhythm, prevent blood clots, which can reduce the risk of stroke. The strategy you choose with your doctor depends on a number of factors, including whether you have other heart problems and whether you can take medication that can control your heart rate. In some cases, you may need additional treatment, such as surgical procedures using catheters or surgery. In some people, a certain event or condition, such as thyroid disease, can cause atrial fibrillation. Treating the condition of atrial fibrillation can help reduce your heart rhythm problems. If your symptoms are disturbing or if this is your first episode of atrial fibrillation, your doctor may try to reset the rhythm. Resetting the rhythm of your heart appropriately. Treatment for atrial fibrillation, heart rate and rhythm is restored to normal. To correct your condition, doctors can reset your heart to its normal rhythm, sinus rhythm, using a procedure called cardioversion, depending on the underlying cause of atrial fibrillation and how long you have had it. Cardioversion can be done in two ways. Electrical disturbances. In this short process, electricity is drawn from your heart by paddles or patches placed on your chest. Shock stops your electrical activity for a while. The goal is to reset your normal heartbeat. You will be given a sedative before the procedure, so you should not feel an electric shock. You can also get antiarrhythmic before the procedure. Cardioversion and drugs. This form of cardioversion uses medications called antiarrhythmic to help restore the normal rhythm of SIN. Depending on your heart condition, you may receive IV or oral medication to help restore your heart rate. This is usually done in a hospital with constant monitoring of your heart rate. If your heart rate returns to normal, your doctor will usually prescribe one or more antidepressant medications to try to prevent further atrial fibrillation. Before a heart attack, you can be given warfarin or other anemia for a few weeks to reduce the risk of clots and blood clots. If your episode of atrial fibrillation lasts more than 48 hours, you may need to take this type of medication for at least a month after the blood clotting process. Maintaining a normal heart rhythm after inhalation, your doctor may prescribe anti-inflammatory drugs to help prevent future episodes of atrial fibrillation. Medications can include dofetilide, flecainide, propafenone, amiodarone, sotalol. Although these drugs can help maintain normal heart rhythm, they can cause side effects, including nausea, dizziness, fatigue. Often, they can cause life-threatening rhythm disturbances from the lower chambers of the heart. These medications may be needed permanently. Even with medication, there is a chance of another episode of atrial fibrillation. Heart control. You may be given medication to control your heart rate and return to normal. Digoxin. These medications can control heart rate at rest, but not even during work. Most people need additional or different medications, such as calcium channel blockers or beta blockers. Beta blockers. These medications can help reduce heart rate during rest and during work. It can cause side effects such as low blood pressure, hypotension. Calcium channel blockers. These medications can also control your heart rate, but may need to be avoided if you have heart failure or low blood pressure. PIPE and surgical procedures. Sometimes medications or cardioversion to control atrial fibrillation do not work. In such cases, your doctor may recommend a procedure to destroy the cardiovascular system that causes irregular electrical signals and restore your heart rate to normal. These options may include pipe discharge. During this procedure, the doctor inserts long, thin tubes, catheters, into your clothes and directs them through the blood vessels to your heart. Catheter tip produces radiofrequency, cold, cryotherapy, or heat to clear areas of the heart tissue that cause rapid and irregular heartbeat. Forms of red tissue, which helps to sign a return to normal. Cardiac arrest can correct arrhythmia without the need for medications or implants. Your doctor may recommend this procedure if you have atrial fibrillation and a heart or regular medication has not improved your symptoms. It can also help patients with heart failure who have a device installed and who are unable to take or tolerate antidepressant medication. Maize Process. There are several variations of the Maize Process. The doctor may use scalpel, radiofrequency or cryotherapy to create a pattern of red tissue that interferes with the electrical current causing atrial fibrillation. Maize procedures have a high rate of success, but atrial fibrillation may return. If this happens, you may need further cardiac surgery or other heart treatment. Because the surgical Maize procedure, using a scalpel, requires open heart surgery, it is simply reserved for people who are better at alternative therapies or when it can be performed during heart surgery required, such as coronary artery bypass surgery or heart valve repair. Atrioventricular, AV, price separation. If medications or other forms of catheter removal do not work or cause side effects, or if you are not the right choice in these treatments, AV node removal may be the option. This procedure involves using a catheter to deliver radiofrequency energy along the way, AV node, that connects the upper and lower heart chambers. The procedure destroys a small area of heart tissue, preventing abnormal signaling. However, the upper chambers of the heart, atria, will still tremble. You will need a pacemaker to be installed so that the lower chambers, ventricles, can blow properly. You will need to take blood surgeons after this procedure to reduce the risk of stroke due to atrial fibrillation. Prevention of blood clots. Many people with atrial fibrillation or those receiving specific treatment for atrial fibrillation are at greater risk of blood clots that can lead to stroke. The risk is very high if another heart disease is present along with atrial fibrillation. Anticoagulants. Your doctor may prescribe anticoagulants such as Warfarin. Warfarin may be prescribed to prevent blood clots. If you are given Warfarin, follow your doctor's instructions carefully. Warfarin is a potent drug that can cause serious bleeding. You will need a regular blood test to monitor the effects of Warfarin. New anticoagulants. New anticoagulants are available to prevent strokes in people with atrial fibrillation. These drugs include dabigatran, rivaroxaban powder, apixaban and edoxaban. They are shorter than Warfarin and usually do not require regular blood tests or supervision by your doctor. These drugs are not approved for people with mechanical heart valves. Most people have atrial fibrillation spells and do not know it at all, so you may need anticoagulants for the rest of your life even after your rhythm has returned to normal. Closure of the left atrial appendix. Your doctor may also consider a procedure called left atrial appendage closure. In this procedure, doctors insert a duct into the artery and then direct it to the left upper chamber, left atrium. A device called the atrial appendage closet device is then fitted with a catheter to close a small sac, appendix, in the left atrium. This may reduce the risk of blood clots in some people with atrial fibrillation, as many blood clots are found in the form of atrial fibrillation in the left appendage of the atrial. Participants in this procedure may include those who do not have heart valve problems, have an increased risk of blood clots and bleeding, and who are unable to take anticoagulants. Your doctor will examine you and determine if you are ready for the procedure. Lifestyles and home. You may need to make changes in your lifestyle that improve your overall health of your heart, especially to prevent or treat conditions such as high blood pressure and heart disease. Your doctor may suggest a number of lifestyle changes, including: eat hearty foods. Eat a healthy diet high in salt and fat and rich in whole fruits, vegetables and whole grains. Exercise regularly. Exercise daily and increase your physical activity. Stop smoking. If you smoke and cannot quit on your own, talk to your doctor about strategies or plans to help you break the habit. Maintain a healthy weight. Obesity increases the risk of heart disease. Healthy weight loss can help manage the symptoms of atrial fibrillation and can improve the effects of catheter ablation. Keep blood pressure and cholesterol levels under control. Make changes in your lifestyle and take medication as prescribed to correct high blood pressure, hypertension, or high cholesterol. Drink alcohol in moderation. Excessive drinking, drinking 5 drinks every 2 hours for men or 4 drinks for women, can increase your chances of atrial fibrillation. For some people, even a small amount of alcohol can cause atrial fibrillation. Keep track of. Take your medication as prescribed and have regular follow-up appointments with your doctor. Tell your doctor if your symptoms worsen. Preparing for your appointment. If you think you may have atrial fibrillation, it is important that you make an appointment with your family doctor. If atrial fibrillation is diagnosed early, your treatment can be simple and effective. However, you may be referred to a cardiologist. Because appointments can be short, and because they are often discussed, it is best to be ready for your appointment. Here is information that will help you prepare for your appointment, and what you can expect from your doctor. What you can do. Know any pre-appointment restrictions. When making an appointment, be sure to ask if there is anything you need to do in advance, such as cutting back on food. You may need to do this if your doctor orders a blood test. Write down any symptoms you are experiencing, including any that may not be related to atrial fibrillation. Write down your key details, including any family history of heart disease, stroke, high blood pressure or diabetes, and any major depression or recent health changes. Make a list of all the medications, vitamins or supplements you take. Go with a family member or friend, if possible. Sometimes it can be difficult to understand and remember all the information given to you during an appointment. Your traveling companion may remember something that you missed. Write down the questions you will ask your doctor. Your time with your doctor is limited, so preparing a questionnaire will help you to spend more time together. Make a list of your most important questions, most important, if any. For atrial fibrillation, some basic questions to ask your doctor include: what causes my symptoms or condition? What are some of the causes of my symptoms or my condition? What types of tests will I need? What treatment is most appropriate? What foods should I eat or avoid? What is the right level of physical activity? How often should I be tested for heart disease or other atrial fibrillation problems? What are some of the ways in which you recommend it? I have other health conditions. How can I treat them better together? Are there limits I need to follow? Should I see a qualified physician? What will that cost, and will my insurance pay to see an expert? You may need to ask your insurance provider directly for information about availability. Is there an alternative to prescription drugs? Are there any brochures or other printed material that I can take home? Which websites do you recommend visiting? In addition to the questions you have prepared to ask your doctor, do not hesitate to ask questions during your appointment. What to expect from your doctor. Your doctor may ask you many questions. Being prepared to answer them may save you more time than any other point of view on which you want to spend more time. Your doctor may ask: when did you first experience symptoms? Have your symptoms been persistent or intermittent? How bad are your symptoms? What, if anything, seems to improve your symptoms? What, if anything, seems to make your symptoms worse? Please subscribe, like and share, comment.